Good morning and welcome to another session for PW2002. Today we're going to look at the legal, ethical and professional aspects of medicines management. So some of this will be a recap of some of the things that we looked at last year in PW1002, but it's also going to be a little bit more in depth, and this is going to link into the tasks that you've got today, link into the video that you might have watched last week about drug trials, and lead into the discussion that we'll have in the seminar this afternoon. So in this first part, we're going to look at the legal side. So we're going to look at the legislation in relation to drug administration and medicines management. And then we're also going to look at the ethical side when we think about consent, covert administration, drug errors, and as we said, drug trials. So hopefully it should be quite an interesting session for you. So as we've looked at previously, we've got to think about the 5 R's of medicines management. So recapping from last year, these are that whenever we're dealing with medicines and whenever we're dealing with anything to do with medicines management, if we are administering our medications, we have to make sure that we've got the right patient, that we're giving them the right time and frequency of administration. This is especially important when we're thinking about certain medications, for example, Parkinson's medications. And we've got to think about, are we giving our patients the medications at the correct time, that either they have been prescribed them or that they have been advised to take them to maintain their problems or to maintain their symptoms. That we're giving them the right dose of medication, that it's going in via the right route, and that we're definitely giving them the right medication, that there haven't been any issues or mix-ups with the medications not being in correct boxes and things. Obviously there's lots of different things that we've got to think about around those, but it is really imperative that if we are dealing with medicines or we are administering medicines or we're supporting our patients with the administration of medications, that we are thinking about these 5 R's at all times. And of course these 5 R's also link into the 6 C's. So if we remember back to our 6 C's of nursing and of working in the health service, and we think about care, compassion, competence, courage, commitment and communication, we've got to think about how these NHS values or how these nursing values and beliefs actually apply within medicines management. Because if we're not thinking about our 6 C's and we're not thinking about the key things that we've got to be as practitioners within the health service, we're not going to help our patients have the best outcome and the best quality of care that we can possibly give them. We've got to be able to support our patients in a compassionate manner, help them, but also help them to feel empowered and engaged with their medicines management. Make sure that they are making informed consent and that they're aware of why they're taking certain medications for which problems that they might have. That we're competent in our role. This might be that we are aware of our limitations, that we're aware that actually it isn't within our role to be administering medications or supporting patients to administer medications, and that we're making ourselves, our patients and other practitioners around us aware of where our competence lies within this. That we have the courage to speak up if we're not competent or it's not part of our role to assist with administration of medicines, and that we communicate this appropriately and we communicate with our patients. If our patients are asking us about medicines management or any issues around them taking their own medications, that we're able to communicate with our patients appropriately to say yes or no, we can help them or we can give them advice. Or if we don't feel competent to be able to do this, that we can signpost them to the appropriate people to get that information, to help them understand the medications that they're taking, why they're taking them and how they should be taking them. And obviously this is a commitment to our role and a commitment to our underpinnings of what an NHS professional or what a healthcare professional might be. So of course we need our 6 C's underpinning us at all times, and this also links back to our apprenticeship standards. When we're thinking about, what we are as assistant practitioners, what our role actually means and how we can work within our apprenticeship standards and link to our work-based learning of what we should and shouldn't be doing. So again, it's really key that when we're thinking about our NHS 6Cs, or our NHS values and our apprenticeship standards, that we do have a really good underpinning of what we can do and what your role is. So when we're thinking about legislations, we have lots of different legislations to be thinking about. Obviously, we're still within Europe currently, just. Brexit hasn't quite happened yet. We haven't fully withdrawn from Europe. So we are still bound by European legislations. But we're primarily bound by our UK legislation, or our acts, and we're going to look at those in a little bit more detail later on. And we're also bound by our secondary UK legislations, or our regulatory bodies. So again, I know the assistant practitioner isn't currently fully under any one regulatory body. However, if you're in a more nursing role, you're probably going to be advised to look more at the NMC regulations and the Royal College of Nursing productions. Whereas if you're in a more therapies role, you might be asked to look more at the HCPC legislations on what they say around medicines management and legislations around medicines management. And of course, we also have our local policies and procedures. So again, your role or your specific area might have particular policies and procedures around what you can and can't do as an assistant practitioner and where your role lies. This might be looking at things like patient group directives or patient-specific directives, so PGDs or PSGs, looking at what you can and can't do within your role and how your role within administration of medicines might actually be underpinned. So it's really important that when we're thinking about our different legislations, that we're aware of all the different levels, that we're aware of the fact that we are bound by our main acts of legislation from the government, but we're also bound by our secondary legislations and our local policies and procedures. So some of the key legislations that you might come under, and I have more links to these if you go back into that resources section on your OneNote notebook for 2002. I've got more links. Obviously you can click on the links within the PowerPoint, so if you go back to the PowerPoint to work through it at your own pace. But I've also got a lot of the links to these legislations within the resources section of your notebook. So some of the key pieces of of legislation that we might be under are the Medicines Act from 1968, the Misuse of Drugs Act from 1971, the Human Medicines Act from 2012, the Medicines and Healthcare Products Regulatory Agency, and obviously this is a government document and is being updated all the time, the Human Medicines Regulations 2012, which is a follow-on from the Human Medicines Act 2012, and the European Medicines Agency, which, as I said, even though we're coming out of Europe because of Brexit, currently we're still underpinned by the European Medicines Agency as well. So it's well worth having a look at some of the links and some of the information on these particular acts of legislation, just to help you give a little bit more underpinning as to what we might do and why we might do them. I'm not going to go through a lot of these in detail within this PowerPoint, because not all of them might relate to your chosen medication for the assignment. So it's just good to have an awareness of the different pieces of legislation that underpin us, and to go away, to click on the resources, to click on the links that I've included, or to click on the links that are on this page, to actually look at these and to look at how we might use them linking to our specific chosen medications. The one act that I'm going to look at in a little bit of detail is to think about the Medicines Act 1968. Now again, we did look at this earlier on in the module and last year in 1002, and this was really thinking about the main three classifications that medicines might fall under. So are they prescription only medications? Are they medications that you can only get on prescription from a practitioner who has prescribing rights? So we might think about medications that are prescribed by our GP or by nurse practitioners or by other allied health professionals who have completed their prescription or their prescribing courses, so they can actually be part of the diagnosis, they can be part of the treatment plans, and they then might prescribe certain medications. Are medications that we need to go to the pharmacy to get, so we can still buy them freely, but we have to go and speak to somebody at the pharmacy and buy them from behind the counter? Or are our medication that we're looking at on the general sales list, for example, something like paracetamol or ibuprofen, and is it something that can be bought freely, maybe following certain guidelines? For example, you can only buy 2 packets of paracetamols or 2 packets of ibuprofen at any one time within the UK. But are these things that we could quite easily go to any shop in particular that might sell medications and buy it freely off the shelf? So it's really quite useful looking at this, because when we're thinking about our assignment, we're probably going to be looking at identifying which classification within the Medicines Act our chosen medication is actually going to fall. The second thing or piece of legislation or key support that we're going to think about are the responsibilities of the MHRA. So this is the Medicines and Healthcare Regulation Agency. And this agency is going to help support and uphold the legislation of the Medicines Act and enforce the provisions and secondary legislation as well from local trusts or from local regulatory bodies to actually help us to think about our medications. They also help to regulate the sale, supply and administration of all medicines available in the UK. And they also work alongside NICE, looking at which medications should be on sale, which medications should be supplied, and how we actually decide which medications should be looked at or identified that need to be looked at in more detail as to whether they're appropriate or not. They also work alongside NICE to think about our supply of medications when we think about which medications should be advised by the NHS and other healthcare regulatory bodies, to think about how we're actually supporting our patients. And this can link into things like, cost effectiveness and benefits or side effects and other worries. So they actually help to underpin our ability and availability of medications, thinking about what we should and shouldn't be using within the UK. So as we said, even though your actual roles and responsibilities might not necessarily lie within our administration of medications, it's really, really important that you're aware of your expectations within medicines management. A lot of you work for East Lancs in this particular cohorts or other specific NHS trusts, which are saying, even though your roles aren't sitting within an administration role, it is really, really key that you have this basic underpinning of medicines management. So it's really important that you've got this basic knowledge of what does the law and legislation say about medicines management. It might not look specifically at your role, but it's really, really important that you have this basic underpinning. And what do these legislations, what does the law mean to me? Do I have any responsibilities around that? Or what does it actually mean to my patient? Do they have any responsibilities? If you're going to give a medication, do you actually know about that medication? If you're not going to give a medication because your role doesn't involve the administration of medications, you've also got to think about, well, what are the medications that my particular patients may be taking? And how might they impact the care that I'm going to give to my patient? Are there anything that I need to be thinking about? Do I actually know what this medication does? If a patient asks me, can I actually help them or advise them or support them as to what that particular medication that they might be worried or concerned about does? Do I know how it is supplied? Is it supplied because the patient goes and gets it themselves? Or is it supplied through a pharmacy or through another medical administration practitioner. So how do the patients get hold of this particular medication? Does it have any important things to think about around storage? Do we have to be making sure that patients are storing medications appropriately so they're not going to have any issues with medications not working correctly because they haven't been stored correctly? Are our patients aware of how our medications should be disposed of? Are they just throwing them away or flushing them down the toilet? Or are they actually aware of the appropriate ways that they should be getting rid of any out-of-date or unused medications? If you are taking part in the administration of medications, are you aware in the correct manner to actually support the administration of medications for your patients? And are you aware of any side effects or contraindications? If patients are discussing things with you and they're talking about side effects that they might be having or new signs and symptoms that they might be having, are we aware of the medications that our patients might be on and what these side effects might actually be? Are they new? Might there be side effects of medications? And if so, do we need to support our patients in getting extra advice and extra support? Or are there any contraindications? Is a patient telling you that they've started taking a general sales list item or a herbal remedy, which might actually be contraindicated with the medication that they're on? Remember, a lot of people might like to have grapefruit in the morning, but actually grapefruit is contraindicated for an awful lot of medications because it changes the way that these medications are absorbed or metabolized within the body, if we're thinking back to our pharmacokinetics. So it's really, really important that even if we're not directly involved in the administration of medications, we really have to have the basic underpinning of what is medicines management so that we can actually complete our role appropriately and professionally. So again, in exercising your professional accountability, it's really, really important that, again, like I've said previously, that you know what the medicine's for, what its average normal dosage is, the side effects that you might have from that particular medications, and precautions and contraindications. So this is really why when we're thinking to our assignment and we're thinking to what we have to do for our assignment, picking this key drug that either we use because it's part of our role or that our patients are regularly on is going to really help us to be able to underpin this knowledge, because we should then be aware of normal dosages, any side effects, precautions and contraindications. And this is really going to link into your learning outcome too for your assignment, to actually be able to support your patient and to have that basic knowledge and underpinning. Excuse me. You need to make sure that if you are working to support a patient, that they are the patient that is identified within the care plan, or that they are identified within the medication. That you're aware of the patient's care plan and whether they have any underlying other medical conditions, any comorbidities, or anything that you need to be aware of when you're supporting your patient. And if a patient is asking you about something or you are administering medication, it's really important that you need to make sure that the prescription or label on the dispensed medication is clearly written and unambiguous. So many medical errors when we're thinking about medication are about poor handwriting or medicines not being dispensed appropriately because they've used abbreviations of certain medications, or they've used abbreviations of dosages, and this hasn't then transpired into the actual dispensed medication, and therefore the dispensed medication isn't the appropriate one for the patient. You also need to think about your dosage, method of administration, route and timing of the administration in the context of your patient and the condition that this medication is supposed to be supporting, and any other coexisting therapies. If a patient's taking a blood pressure medication, for example, which actually does have an impact upon the patient and might make them feel a little bit woozy or a little bit faint, or lead to a postural drop, making them have a little bit of a head rush on standing, and you're trying to support a patient maybe with walking or a mobility assessment, It's really important that you're aware of some of these things, because it might be if they take their medication and they know that about an hour after they take their medication they can feel a bit off, doing a mobility assessment around this particular time might not give you a true representation of the patient's ability. So it might be that you have to look at, any therapies that the patient is receiving and linking this to any medications that a patient might be receiving at the same time. Because when talking to patients, or from personal experience, if you've ever taken medications, you might be able to know that some medications make you a little bit sleepy, or some medications make you a little bit wobbly, and it's really important that you're aware of this when you're undertaking any therapies or treatment plans with your patients. You need to make sure that your expiry dates of your medicines are still within time, that patients aren't taking medicines that are out of date just because they want to use them up, and that we're not just keeping random things in cupboards or in patients' cupboards. Obviously, if we're working within a hospital area or another area that stores its own medications, there will be policies and procedures to follow around the checking of sell-by dates or expiry dates on medications to make sure that you're not holding on to any expired or nearly expired stock. But it's also important that we remind our patients to do the same, because the expiry dates on medication boxes are sometimes quite hard to see, and patients might not necessarily be aware that the medications that they have are out of date or might be nearing their expiry dates. You also need to check that your patient's not allergic to the medication before any administration or before supporting people with administration of medication. So it's really key that we look at that. And when we're thinking about allergies and things, it's also important to be aware that certain medications, and I think we've discussed this before, but certain medications might also be made with things that a patient might be allergic to or have an allergy to. When we're thinking about things like some medications contain gluten, so if we have celiac patients or patients who are gluten intolerant, if the patients aren't aware, that could cause problems for them through gluten intolerances or allergies. And some medications are made with gelatin within capsules and other coatings on medications. So again, if we've got patients who are vegetarians or vegans, or depending on their cultural or religious backgrounds, again, we need to be aware that some of these medications might actually have an impact upon our patient if they're not made aware of things, or if prescribers aren't made aware of certain conditions that our patients are undergoing, or certain cultural practices. And this might have an impact upon concordance and adherence to medications if patients find out that these medications actually include something that they may not be aware of or may not be happy to take. So it's really, really important when we're thinking about our patients that we're thinking about them as a whole, not just as a medical condition, and this medication will make them better. If there are any issues or anything that you discover, you need to make sure that either yourself contacts the prescriber, or you advise the patient to contact the prescriber without any delay, so that you can actually help the patient to be supported. If there are any major side effects or contraindications, or the patient develops any kind of life-threatening or major reaction, it's really important that you follow your trust policies or guidance, or you link to the BNF and you actually use that yellow sheet within the BNF to report these, because it might be something that's very minor, and it might just be that actually, yes, we're aware of this, and the prescriber might be able to have more conversation with the patient. Or it might be something that needs to be reported back using those yellow forms. So it's really, really important that you do make sure that these things are discussed, and that you are advising the patient or the prescriber that something untoward has occurred. And you need to also think about your documentation. If you are administering medication, you need to make sure that you document it straight after you've administered this medication, of what you administered, what happened, what didn't happen. And you also need to, if you're working with patients and they're telling you that they're not taking certain medications, again, this also needs to be documented, because it might be that you're the first person they've told. So this obviously needs to be discussed in more detail or taken further forward. Or it might be that they've told multiple medical professionals, but actually nobody's documented this, and this patient has actually gone without certain medications for weeks and weeks and weeks, but they didn't think it was important, but nobody's actually documented this. So I had a discussion either with the prescriber or the GP or the other medical professionals to actually decide what the appropriate thing to do is. And obviously, if you need to make any medical calculations, it's always best to think about, are you aware of this? Is this something that you're doing on a regular basis? Are you feeling competent and happy with doing this? Or is this something that actually you need to take a little bit further forward so that you can actually make sure that the medications or the dosages that you're giving to your patients are accurate and correct? So when we're thinking about some of the ethical issues that can also occur within administration of medicines, we've got to think about the covert administration. So this is when patients aren't aware that they are being administered certain medications. And obviously this raises a massive ethical issue of consent. If we think about consent, our patients should always have informed consent and be aware that they can actually refuse to have a certain treatment or a certain intervention applied to them. And if medications are being administered covertly without the patient's knowledge, either being hidden in drinks or hidden in food or being administered in other ways, obviously this takes away the ability for the patient to actually consent to the treatment plan which is happening. It also has further implications for mental capacity, because if a patient is under the Mental Capacity Act in any particular way, there needs to be further discussion with carers, with health practitioners, as to whether the covert administration of medication is being undertaken appropriately. So it's a really, really deep ethical issue, and it might be something when we're thinking about our assignment and you're thinking about any ethical issues, excuse me, are we covertly administering certain medications to our patients? This might be that we're helping take part in certain medical procedures. We might not think we're covertly administering medication to our patients, but if they're undergoing a general anaesthetic, for example, we don't necessarily talk them through every single medication that might be administered as part of the anaesthetic procedure. But is that actually good, bad, or indifferent? So are we actually covertly administering medication to our patients if they're not aware that part of the anaesthetic procedure might be a combination of anaesthetic gases, anaesthetic injections, but also things like local anaesthetics or painkillers or something like midazolam, which might have an amnesic effect? Patients might not be fully aware of what their treatment plan actually compromises of, and would they actually consent to all of these different medications being used if they were actually aware of it? So there's lots and lots of different discussions around whether or not we should be saying to our patients every single medication that we might be using at any one point, so that our patients can actually have true informed consent as to what's actually going along. So I know a lot of different trust policies and procedures around, especially the administration of anaesthetics, are actually changing to say that we should be telling our patients every anaesthetic or every part of the anaesthetic that we're going to use, so that the patients are aware and we're not seen as covertly administering a multitude of different medications without our patients being aware. So some of the things we've got to think about for covert administration of medications, we've got to know that covert administration is not routine practice. It isn't something that should be being done. And it needs to be in the best interest of the patient. And this needs to be considered at all times. If it has been discussed, and it has been discussed that it is in the patient's best interest to covertly administer medication, these medicines must be deemed essential. And there should be open discussions between all the parties who are involved within this discussion. There needs to be really good record keeping as to what's happening, when it's happening, why it's happening, and what the following. It might be that a patient has been deemed as not having capacity, or they're on a doles. So it's just really important to be aware of what we should be doing around the covert administration of medication, because it isn't general practice. You should also be following your local policy around covert administration of medication, when or where or not this should be happening, why it should be happening, and again, are there any other key things that need to be followed to make sure that we're following policy properly. There needs to be regular review of the patient's condition and method of administration. We really need to be aware that, again, our patients are individuals and we shouldn't be using ritualistic practice. This needs to be monitored regularly between all the people who are part of the patient's care plan, and it really needs to be deemed essential as to covertly administering medications. You know, our patients have rights, and they also have a right to informed consent and a right to refusal. So we really need to be aware of all these different things, and we shouldn't be trying to force patients to do something unless it has been deemed by all the appropriate people that it is essential and we have to do it in that particular way. So other ethical issues that we've got to think about are things like, drug trials. How are we creating these medications? How are we moving forward with certain things? So there's quite a lot of documents and links that I've put within the task sheets and within the resources sheets that are thinking about some of the ethical issues around drug trials and around the development of medications. And as you've possibly known, if you watch the news or you look at other medical information journals, things like that medicines are in the news almost every day. There's been local discussion of they're using aspirin daily, the use of the contraceptive pills up there quite a lot, and obviously very contemporary, all the issues around the development of the vaccine for COVID-19. So when we're thinking about all these things, it's really important that we're aware of some of these ethical issues. Now, as I said, we've got some resources on drug trials, we've got some resources on links to medical issues that have gone wrong or errors with medicines management. Have a look at these, have a look at some of the other ethical issues around them, and then we'll have further discussion later on as we go through our seminar in the afternoon. So I want you to think about, really in summary, going back to those tasks, thinking about the tasks and how you can apply the theory from today's session back to the tasks that are set. Some of the tasks are around legislation, some of the tasks are around medication errors, and some of the tasks are around safe administration of medications, which is the second video for today. But go back and have a look at those resources that I've put on. Look at the NMC standards for medicines management. Look at the HCPC standards for medicines management. Think about your role in relation to drug administration. Make sure you're aware of your local trust policies and start to be able to build your background knowledge and apply this to medicines that are used within your area of practice. Thinking specifically about your chosen medication for your assignment. Like anyway, I am here. Any questions, let me know. Contact me in the regular methods, and then we can have a discussion of these later on when we have our seminar. So I hope you've enjoyed that introduction to kind of the legislations around medicines management, and join me again for the self-administration of medications video later on. Bye!